Hi there, welcome to this in-depth video on medical cannabis. This video will cover everything you need to know, the benefits of medical cannabis, what's the difference between medical cannabis and normal cannabis, but also what are the concerns and the side effects, and is it safe to use. I also made a shorter, more to the point video. If you're interested in that one, you can find it in the description, and subscribe for more upcoming videos. So, before we start, a little disclaimer. This video is meant purely informational. This is not medical advice. And if you're looking for medical advice, always contact your own doctor. So, cannabis or medical cannabis is the whole unprocessed plant. And it's used to reduce symptoms or even reduce diseases. It consists of 400 to 500 known compounds, of which are 70 to 100 cannabinoids. And those are the effective substances in cannabis itself. Of those, the most effective ones are THC and CBD. And THC is the psychoactive compound that leads to the high or the stoned feeling people get after smoking cannabis. And CBD is supposedly the therapeutic ingredient that has the that leads to the reduced symptoms or the reduced disease. However, it's very difficult to classify which of the components leads to which effect because there are so many, 400 to 500, and therefore it's also really difficult to study the effects of cannabis. So keep that in mind. And what is the difference between medical cannabis and normal one? First of all, medical cannabis is a certain strain, which are many different strains, and together they're called medical cannabis. And classically, they have the higher CBD content, so the therapeutic content, and a low THC content. So you do not easily or almost impossible for you to get high when using medical cannabis. But of course, there are some differences between the different strains. Classically, recreational marijuana has a high THC content because people use it to become high, which makes sense, of course. It's available as a smoke, so you can burn it and then inhale it in pipes, bongs, or joints. You can vaporize it. You can make cannabis tea from it, which only has really small concentration of THC. You can eat it, make a butter of it, and bake a cake, for example, or it's available in capsules. It has three major uses. So the first one is medical, recreational, and spiritual, but I'm not touching upon the spiritual one. It's the most commonly used drugs worldwide, and even in the United States, 51% of all people reported to have at least once in their life used marijuana. And this is around 2 to 5% of the whole population who has done it at least once. So 9% of all the people who experiments with marijuana becomes dependent on it according to the DSM-4 classification. This is quite a high number, and this is really important to note. If you're looking to medical cannabis, it's prescribed by a physician and used to treat diseases or improve symptoms. However, there's limited clinical research done. First of all, because the production process is a restriction, and because governments worldwide do not allow cannabis to be used. So there's little known about the safety and efficiency. However, some researches are done, and there is a connection between the use of cannabis and the treatment of nausea and vomiting during chemotherapy. You can use this if your usual treatment is ineffective, and supposedly the use of cannabis is even more effective than the usual treatment, but it can lead to more symptoms, and therefore it's not the first choice of treatment. It can also be used in chronic pain and muscle spasm, but there's limited evidence that it really alleviates any pain. However, short-term treatment in peripheral neuropathy can help to experience less pain, and 1 of 5 persons who use cannabis in this situation. Cannabis is completely safe to use in a palliative setting, so you could try if it works for you. Regarding multiple sclerosis, epilepsy, and movement problems, it can be used to reduce spasticity. If your usual treatment is ineffective, and there's no tolerance, abuse, or addiction problems seen in any of these cases, so it's safe to try out. Then in post-traumatic stress disorders, there is not really hard evidence, but cannabis might reduce the symptoms patients are experiencing. For Tourette syndrome, cannabis reduces the amount of tics they are having, and there supposedly would always also be a connection between the improved appetite in people with HIV or AIDS, but there is not really any good evidence for this. And lastly, if your usual treatment is ineffective in anorexia, arthritis, migraine, or glaucoma, then also cannabis can have a positive effect on any of these conditions. If you look to recreational use, people use it mostly for its psychoactive and psychological effects. So it leads to relaxation and euphoria. This is the height or the stoned feeling. It can lead to alteration of the space and time perception. It leads to increased awareness of the sensations and also to an increased libido. And higher dosage may even lead to an altered body image, auditory and visual illusions, hallucinations, ataxia, and a dissociative state where there is depersonalization and derealization. Then, how does this all work? So cannabinoids are lipid soluble and have a very high half-life, which means it takes your body a very long time to clear the cannabis out of your blood, and therefore it will be active there for sometimes more than weeks. So the THC binds to cannabinoid receptors, the CB1 and the CB2. CB1 receptor is mostly found in the brain and the peripheral tissues, and CB2 is mostly found in peripheral tissues. And also it can bind to glycine receptors, but this is not really understood, so I will not talk about that. If you're looking to the binding of THC to a CB1 receptor, this is an agonistic effect which inhibits second messenger systems. Indirectly, this will increase the dopamine concentrations in your brain, and this has the psychotropic effects. So it leads to your altered mood and cognition and creates the feeling of being high. If you then look to the CBD, this is a modulator of mu and delta opioid receptors in your brain and does something for your pain perception. Furthermore, not a lot of research is done to this, so it's not really clear what the precise mechanism of action is, but it's thought to work like what I just described. So if you use it and you smoke it, then within minutes it will be effective, but if you eat it, it takes 30 to 60 minutes, and it will work up to 2 to 6 hours. Of course, the use of cannabis also has some short-term side effects. You can experience a dry mouth, increased appetite, red eyes caused by conjunctivitis. You may feel drowsiness, dizziness, or feeling tired. It can be vomiting, anxiety or panic, and in extreme cases even paranoia. It can be impaired motor skills or muscle twitching, impaired attention and memory, mainly short-term memory loss. There can be increased risk of psychotic symptoms, the inability to think clear, increased risk of accidents because you cannot evaluate the situation properly or might endanger yourself, and lastly, impaired driving ability. And some research is done to this impaired driving ability, where THC may increase your risk of having a vehicle crash with 3 to 7-fold. However, this is not really a causal connection because THC can be in your blood for days to weeks, so it's unclear if people smoked marijuana and then crashed or even smoked it 2 weeks before, and then there of course wouldn't be a causal connection. The use of cannabis also has some long-term side effects. It can have effects on your physical, mental, behavioral and social health, where it can lead to diseases of your liver, lungs, heart and vasculature. For your lungs, it gives a chronic bronchitis type of symptoms with coughing, sputum and wheezing. And cardiovascularly, it may lead to vasculitis, myocardial infarcts, stroke, sudden cardiac death and cardiomyopathy. These are severe complications, but luckily only happen rarely, but you should take them in consideration. The use of long-term cannabis also leads to an impaired retrospective and prospective memory loss executive functions, and cognition. Those are partially reversible, but not fully, and take up to 30 days to partially reverse. We also see a declined IQ, especially if people start younger than 20 years with their use, and they have poorer school performances. Also, there's a strong connection between the use of cannabis and schizophrenia and psychosis, where there's earlier onset of the psychosis, and there also can be a condition which is called acute psychosis, which will last hours to days directly after the use of marijuana. Of course, this is seen in people with genetic predispositions, but you do not know if you are genetically predispositioned before you use it, so be careful. Then there's an increased rate of depressions and anxiety disorders, with also an increased risk of suicide. And of course, cannabis can be addictive, and it's considered a gateway drug, which is the first step upwards to hard drugs. And also people who use cannabis long term report a reduced quality of their own lives. And lastly, it can lead to CHS, which is recurrent nausea, vomiting, and abdominal pain, which only stops if you stop using cannabis. And the pathogenesis is quite unclear, but it's difficult to have this, of course. Now, can cannabis lead to cancer? Cannabis, especially when you smoke it, you inhale several chemical compounds, of which 50 are known carcinogens. I listed some of them right here. But does this lead to increased risk of cancer? Light and moderate use supposedly does not increase your risk of having cancer. However, heavy or long-term use leads to mixed evidence. It leads to increased testicular germ cell cancer, but the connection with lung cancer is unclear, because 97% of all people that use cannabis also use tobacco, and supposedly the risk of tobacco is greater than the risk of using cannabis. So more research needs to be done to give some definite answers. For safety, if you start using medical marijuana, wait 2 weeks before starting with driving to see what side effects you're experiencing. If you're experiencing any dizziness or any other problems, then it's not safe for you to drive. But if you're not experiencing any side effects, you can perfectly drive when using medical marijuana. For alcohol, please do not combine it with cannabis, because it may increase the side effects you're experiencing. And for food, there are no restrictions whatsoever. For pregnancy and lactation, stop the usage of marijuana, because it will have negative outcomes for the mother and the baby. So be very careful. Regarding overdoses, no fatal overdose in humans has ever been reported. So this cannot occur, or at least it's very, very rare. And this leads us to our last slide, the conclusion. So, limited clinical research has been done, so it's unclear what the safety and the efficiency may be. However, some medical usage can be found, mainly the reduce of nausea and vomiting when using chemotherapy, can also reduce peripheral neuropathic pain, and it may reduce spasticity or tics in patients with Tourette or any muscle problems. However, this comes at a price, because it may lead to many short and long-term side effects, of which some can be very severe, like the impaired cognition or even psychosis and schizophrenia. So, more research needs to be done before some definite answers can be given if medical marijuana has a place in classic medical medicine. And for now, it's mostly recreational use. I think that is beneficial for most patients. So I hope you learned something. Feel free to ask any questions in the comment section below. If you're looking for the shorter, more to-the-point video, you can find it in the description, and subscribe for more upcoming videos. Thank you for watching. See you soon.